Hey, sisters in the US, close your eyes and imagine this scene. I want you to really put yourself here, in this exact moment. You're a young woman in your early 20s. You're sitting in an examination room at a women's health clinic somewhere in California. The lighting is a little too bright, the paper crinkles on the exam table, and you've been carrying a weight on your shoulders for weeks. You finally take a deep breath, look the doctor in the eye, and say the words you've been rehearsing in your head. I've decided to terminate the pregnancy. The doctor, a woman in her early 40s with kind eyes and a soft voice, looks up from her clipboard. She pauses for a beat, and then she gives you this warm, almost maternal smile. She says, "Okay, I understand. Let's talk about your options." On the surface, everything seems completely normal. You might even feel a wave of relief. Finally, someone isn't judging me. But what you don't know, what you could never guess just by looking at that white coat and that gentle smile, is that this doctor is a ticking time bomb. You see, this doctor once fought for her life to have a child of her own. She hemorrhaged on the table, lost her uterus, and lost her future as a mother. And from that moment on, every single girl who sits in that chair and asks for an abortion isn't just a patient to her. You are a mirror. And she hates what she sees. Today, we're going deep on a horrifying case that happened right inside a California OB-GYN clinic. A female doctor so consumed by the jealousy of her own infertility that she escalated from bitter envy to serial murder. We're going to dissect her twisted brain step by step, and then I'm giving you 3 essential actionable psychology hacks, black tech for your mind, so you walk out of any clinic safer and stronger. Chapter 1, The Perfect Mask, approximate 350 words. Let's call her Dr. Amy. She was in her early 40s, and by all accounts, she was the kind of doctor women dream of finding. In a world where medical appointments can feel rushed and impersonal, Amy was different. She remembered your name. She remembered if you mentioned a tough exam or a breakup 3 months ago. She held your hand if you were nervous. The nurses adored her because she never lost her cool, and the patients left reviews calling her the big sister I never had. But behind that pristine professional mask was a shattered personal life. A few years prior, Dr. Amy had been the one on the table. She was the one in labor, and something went catastrophically wrong. The details are grim: a massive hemorrhage, doctors scrambling, the cold announcement that to save her life, they had to perform an emergency hysterectomy. They saved her body, but a part of her soul died on that operating table. She woke up to the news that the one thing she defined as her womanhood, her ability to create life, was gone forever. At first, the darkness was subtle. It started as just being extra. If a young college student came in for a termination consultation, Amy would linger. She'd ask questions that weren't strictly on the medical chart. Why are you really doing this? Are you sure? Do you know how many women would kill to be in your position? The patients chalked it up to thoroughness, or maybe a slightly old-fashioned bedside manner. But it was the beginning of a psychological sinkhole. Amy wasn't just asking questions, she was taking an inventory. She was ranking the worthiness of every woman who walked through that door. And in her mind, none of them were worthy. Not a single one. Chapter 2, Inside the Twisted Brain, The Psychology of Why Her and Not Me, approximate 500 words. Alright, psychology nerds, let's pull out the DSM and really get into the gears grinding inside Amy's head. This is the part that separates this case from just being a crazy news headline. This is about traumatic projection and cognitive dissonance. First, we need to understand that jealousy is a normal human emotion. If your neighbor buys a Tesla Plaid and you're stuck with a 98 Corolla, you feel a little pang. That's normal. But when jealousy fuses with unresolved complex grief, it becomes a nuclear reactor of toxicity. For Amy, her own traumatic birth wasn't just a medical event. It was a narcissistic injury. It was a deep wound to her identity. In her mind, she had done everything right. She wanted a baby, she got pregnant, she was ready for motherhood. And yet, the universe ripped it away. In her head, she was a martyr to motherhood. Now, flash forward. Every time a young girl, especially a younger, seemingly carefree girl, sat across from her and said, "I want to end this," it triggered a catastrophic comparison in Amy's brain. Her internal monologue, which we've pieced together from psychological profiling of similar offenders, sounded something like this. "I bled out on a table. I lost my organs. I would have given my life just for a chance at what you have. And you're just throwing it in the trash? Like it's a bad haircut? Like it's an inconvenience? This is the fairness fallacy. Amy's brain could not reconcile the injustice of her own situation with the perceived ease of her patient's choice. The cognitive dissonance was so painful. I'm a good person/healer versus I want this woman to suffer, that her brain had to create a new reality to function. That new reality was, these girls are evil. They are wasteful. They are not deserving of my protection. We see this pattern in a lot of extreme cases, like workplace shooters who feel passed over for a promotion. The world didn't give them what they felt entitled to, so they decide the world, or the people who did get the promotion, must be punished. In Amy's case, the clinic became her hunting ground. She wasn't killing patients. In her twisted mind, she was restoring cosmic balance. She was making them feel the loss that she felt every single morning when she woke up with a scar on her abdomen in an empty nursery. Chapter 3, The Escalation Ladder, From Jealousy to Murder, approximate 400 words. This is a classic desensitization loop. No one wakes up one morning and says, I think I'll be a serial killer today. It's a staircase, and Amy walked down it one step at a time. Step 1. Intrusive thoughts and verbal judgment. She starts asking those slightly too personal questions. What does your boyfriend think? What about your parents? She gets a little dopamine hit from making the girl squirm. It's a tiny taste of control. Step 2. Substandard care. She doesn't go for the kill yet. Maybe she's just a little rougher with the speculum than necessary. Maybe she forgets to warn the patient about the cramping pain of the medication. She wants to see the fear in their eyes. That's the next dose of the drug. Step 3. The accidents. This is where it gets fatal. Amy is a doctor. She knows the human body better than a mechanic knows a car engine. She knows exactly how much medication is too much. She knows how to nick an artery and then act surprised when the bleeding won't stop. The first victim was a 22-year-old college student. She went in for a simple procedure and never woke up. The medical board called it a rare complication. Amy called it justice. Step 4. The God complex. By the fourth victim, who was given a massive lethal overdose of post-op medication, Amy had completely detached. She had done it so many times that her brain had built a fortress of rationalization. She would stand there in the aftermath, looking at the crash cart and the chaos, and she would play the part of the grieving doctor. She'd wipe away a tear, tell the family she was so sorry, and then walk back to her office to schedule the next appointment. She had become the judge, jury, and executioner of the fertility ward. Chapter 4, 3 Essential Red Flag Hacks, Psychology Black Tech for Your Safety, approximate 600 words. Okay, that was heavy, but knowledge is power. Let's shift from the darkness of her mind to the light of protecting yours. I'm not here just to tell scary stories. I'm here to give you tools. Think of these next 3 points as your mental gym workout. Practice them, and your psychological immune system gets stronger. Red flag hack number 1, the boundary stress test, observation of overpersonalization. Here's the trick. A good doctor asks, what? A dangerous doctor fixates on why. Good. What is your medical history? What are your symptoms? Red flag. Why did you let this happen? Why don't you want to keep it? Why aren't you thinking about your future? If a doctor is treating your medical decision like a moral debate or a therapy session, that's not bedside manner. That's information gathering for judgment. The hack is this: pause and redirect. If they ask a why that feels loaded, you answer with a fact, not a feeling. Say, I'm here for the medical procedure, not the counseling. Let's stick to the physical exam. Watch their reaction. A professional will respect the boundary. A predator will get visibly irritated or double down. That irritation is your signal to walk out the door. Red flag hack number 2, the best friend swap, overriding cognitive bias. Our brains are wired to be polite. It's called the social contract. Especially as women, we are conditioned not to make a scene. We tell ourselves she's just thorough, or I'm being too sensitive. This is the voice that gets women killed. Here's the mental hack. I want you to imagine your absolute best friend, the one who would key an ex's car for you, is sitting in your place. And she's describing this doctor to you. Hey girl, this doctor kept asking me if I felt guilty. She kept saying it was a big choice. She seemed kind of mad when I said I was sure. What would you tell your best friend? Would you tell her to just be nice and get it over with? Hell no. You'd say, get your stuff. We're leaving. That vibe is OFF. We are kinder and more protective of our friends than we are of ourselves. Use the best friend swap to break the trance of politeness. Red flag hack number 3, the digital shadow, creating a witness. Never walk into a situation that feels off, completely alone and invisible. Amy was able to do what she did because it was her word against the unconscious or deceased patient's word. There were no witnesses in that exam room. The hack: before an appointment that makes you nervous, text the address, the doctor's full name, and your expected finish time to at least 2 people. Say, checking in. I'll text you when I'm out. If you don't hear from me by time, call me. If I don't answer, call the clinic front desk to check. Even better, bring a physical friend, even if they wait in the lobby. The knowledge that someone is specifically waiting for you and aware of the timeline is the single biggest deterrent to this type of predator. Amy targeted isolated women. Don't be isolated. Create a digital shadow. Chapter 5, the aftermath and the lesson, approximate 450 words. The police eventually caught Amy not because of a dramatic confession, but because of data. A sharp-eyed hospital administrator noticed a statistical anomaly. Amy's patient mortality rate for a routine outpatient procedure was 4 times the national average. They pulled the drug logs. They pulled the surgical timestamps. The pattern was undeniable. When they confronted her, the mask finally cracked. She didn't deny it. She sat there in her white coat and reportedly said something along the lines of, they didn't understand what they were losing. Now they do. This case is terrifying, but it's also a powerful, albeit extreme, example of a universal human flaw: projection. We all project. We project our insecurities onto our partners, our coworkers, even the barista who messes up our latte. The difference is that most of us have the coping skills to realize, hey, I'm not mad at the latte. I'm mad about my job. Amy lacked that circuit breaker. Her trauma fused with her profession and turned her healing hands into weapons. The families of the victims later described a common thread, a strange feeling, a comment the doctor made that was filed away in the weird but maybe I misheard it folder. One mother said her daughter texted her from the waiting room, the doctor is really intense. She keeps talking about how lucky I am to be young. It's a little weirdo. That is your alarm system. That little "oh" at the end is the brain trying to minimize the threat. Don't minimize it. Listen to that whisper. It's not paranoia, it's pattern recognition. OUTRO approximate 100 words. So sisters, if you were sitting in that clinic and the vibe was off, what would you do? Would you stay quiet or would you trust your gut? Let me know in the comments. Let's turn this comment section into a support group for trusting our intuition. This story is a brutal reminder that we can't always see the monsters, but we can learn their patterns. Guard your mental boundaries like you guard your drink at a party. Stay consistent, stay strong, and don't ever let anyone make you feel like your intuition is an overreaction. Thanks for watching. If you got something out of this deep dive, smash that like button. It really helps the algorithm share these tools with more women. Subscribe and ring the bell so you don't miss the next breakdown. Stay safe, stay aware, and take care of your mind.